So my name is Joanna Johnson. Nice to meet everybody here. I am a psychiatric mental health nurse practitioner, and today I'm going to talk about executive functioning and mental health. Super easy objectives. I'm going to just introduce myself, and then I'm going to introduce the NDSU Student Health Service, and then we're going to discuss some executive functioning skills and the impact to mental health, and then hopefully you leave with a few tips that you can share. Okay, super easy. Like I said, I'm Joanna Johnson, and I'm a psychiatric mental health nurse practitioner. Nurses always like all these initials after their name, so it gets a little confusing. Just talks about the level of education, your scope of practice, and your specialty. But I got my master's of science in nursing as a nurse practitioner and my doctor of nursing practice at University of North Dakota. Um, and I am a board certified nurse practitioner, again, in psychiatry specifically. Okay. I've been practicing in Fargo since 2014. And during this time, I have a lot of different kind of experience. I did work 1 year inpatient at Sanford Health in their inpatient psychiatry department. And then for about 10 years, I worked in the private practice sector. And during that time, I spent 6 of those years also providing medication management to child adolescent population at what we call a pediatric residential treatment facility, Luther Hall in town. So I got a lot of experience through the lifespan there. I am a speaker. I've spoke at NDSU conferences before, and I've also given several talks for the International Society of Psychiatric Nurses, which is a national conference. And I have been at Student Health Service since 2024. So I'm new to Student Health Service and I'm a new NDSU employee. But I have learned a lot in this last year. So I am prepared this year. Nothing is going to be my first, hopefully, this year. Hopefully, have it figured out. And I don't know if you are familiar with Student Health Services, but we are located in the Wallman Wellness Building. We're just across from the student daycare service. Now, if you're coming in the north doors, we're on the left. It's just a little door. You could walk right past it, not even know. Could look like a closet door, even. But when you open it up, it's a whole clinic. And the clinic has primary providers, but it also has a bit of a walk-in service. So a student could call, "Can I get in today? I have a fever, I have a rash, I cut myself." They have a lot of that kind of services. And we also do a lot of sexual health. So we host the Sextival at Student Health a couple of times a year. Um, and so we're a good resource for those things. We also offer psychiatry, where I am the first full-time mental health provider there, but all the other providers are primary providers and can also provide mental health care as well. We have Kaylee, the dietitian, who spoke before I did. We have a full service laboratory, but they will send some labs out, but some they can do in-house. We have a pharmacy that'll fill prescriptions and has over-the-counter medications for students as well. And then we have an X-ray. Again, you would never know it. It's one door in the hallway that you could walk right past, and it opens up to a big thing. And then there's a lot of background people. I just want to give a shout out because I know we offer these services, but we have a great nursing staff, administrative staff. Our wellness director is there. So we're a good team. So at Student Health Service, we also collaborate with in the NDSU community. So, as a mental health provider in particular, I communicate with the counseling center, and about once a month, I meet with the counseling center. And for the students that we have a release of information for, we can discuss cases, sure up treatment plans and stuff like that. But the counseling center, and I don't know if you guys are aware of this, they also do ADHD testing for students. This is an amazing service to me because I worked in the community for so long. I know the wait. But they can get students in relatively quickly, and there's no charge to the insurance, but the fee is under $100, or at least it was last year. Don't quote me, I don't know. Inflation is up there, so I don't know if that's going to affect that. But yeah, it's a pretty quick turnaround service. Bill used to do the testing and evaluation of the testing, and now Terry Ann is doing the testing. And the counseling center, I don't know if you guys know that it's totally a free service to the students. So it's not anything that gets billed through their insurance. So if a student is struggling at all and you just think they need to talk to somebody, that's a free service. At the student health service, we are outside of Kaylee, our dietitian, we are an insurance billed service. So to see me, we're going to bill your insurance or to see the providers. Yeah. So we work closely with the counseling center. Kudos to them. And then we also work with case management, Nicole and Angie. They do a great job. They have a lot of student resources. So not just of the NDSU community again, but also of the Fargo Moorhead area at large for the students resources, whether it's food insecurity or inpatient or long-term mental health, or someone's graduating and needs resources, or even just students that are struggling, need to have a conversation with a professor or something like that. There's a lot case management can do, and I don't want to shorten what they do because they do a lot. But again, another entity we work with. And then also Cater, the Center for Accessibility and Disability Resources, because I will send diagnostic clarification to ensure that the students can get accommodations if needed. And then, so a lot of it's just interacting and making sure that we're providing the best care to students as we go along. All right. So I'm going to talk about executive functioning skills, um, and the like. But first, what I want to do is kind of tell you a little bit about how I got here. So my job as a psychiatric provider is to assess, diagnose, and treat those with a mental health disorder. We use the DSM-5 as our diagnostic manual. But not everybody that comes into my office has a DSM disorder, right? Just because you're worried and have anxiety doesn't mean you have a generalized anxiety disorder. Same thing. You got a low mood, you're in a funk, doesn't mean you have a major depressive disorder. In fact, oftentimes what I'm seeing is maybe some situational struggles, right? Being away to school, missing family, just being on their own and being on their own devices. So of their own devices, so that they're struggling. Uh, They're smart, they're capable, which is more distressing to them because they're just feeling terrible and they just come in like they're overwhelmed. So in the last year, I have seen 255, I just checked today, individual students. So great number. So they're coming in, they know I'm there. But as I'm listening to people, again, I have community experience through the lifespan, but now it's this condensed community of students for me. Um, but people are coming in and they're having a lot of the same complaints, the same worries, the same stressors. And I started feel like I started saying a lot of the same things and having a lot of the same advice. And then I went, I think I'm onto something. I got to find a way to help students, just like anyone would, right? As you're coming across these things. Now, students are coming to college, sometimes just right out of high school. And so some of their executive functioning skills might not be fully developed, as one would imagine. But ADHD is a concern for people with mental health disorders in general. Okay. So even if we have depression, we can have some really difficult time paying attention and motivating ourselves. If we have a lot of anxiety, we might be more emotionally impulsive or physically impulsive. And ADHD is actually a disorder of executive functioning, right? So that in and of itself, that hyperactivity, distractibility, all that is executive functioning skills. Now, executive functioning skills are not fixed. They're not something like you were just born with bad ones, suck it up. They're actually something that you can grow, master even. just takes practice like anything else. It's going to take a lot of practice. So we know that ADHD is a childhood disorder, but then a lot of students are coming, um, into college, not just at NDSU, but other colleges as well. And other adults are getting diagnosed with ADHD. So we have to kind of wonder, how is that? If it's a childhood illness, how you get through childhood, no one knows you have ADHD. You graduated high school, you clearly don't have a problem. But ADHD isn't about, doesn't mean anything as far as you're smart or not smart, right? There's ADHD again is it's a disorder that affects that executive functioning, but we can strengthen and encourage. And so that's what I'm going to talk about today. And so I have seen some students come in, for instance, that maybe don't have that typical ADHD, say, presentation. I'll just go with ADHD presentation. But maybe they come in, you guys, if you work with students or if you were a student, you might recognize what I'm saying, but that perfectionist, I'll just say it's a female because most of the time it is, but it's not always. But this perfectionist, right? She made it through high school, but she did all the work, she worked really hard, all the extracurriculars and coming home and homework, graduates top of her class, right? Everyone's like, "You're a perfectionist, you just, right?" And then she gets to college and those same skills aren't working. And she's working harder. She's rereading. The grades are coming in and they're not as great as she feels they should be. And this is a struggle and the anxiety is growing, growing, growing to the point that she's in my office. So people come in my office, they're usually pretty distressed because they try to do other things before coming to see me. But let's just say we live in North Dakota, so Midwest, got a lot of rural areas. Let's just say there was a kid that was raised in a rural area, um, and um, when you're in a rural area, everyone knows everybody, right? Everyone knows everyone's business, but also the teachers know you. They know who to sit you by, who not to sit you by. They know your weaknesses, they know your strengths, and they try to encourage your strengths, help you overcome your weaknesses, and they kind of can give you a lot of support in that way. Not always, but this I've seen it enough, right? To know that this does happen. And then this student, he goes through high school and, not really paying attention, but he's doing his work, getting done real fast so he can go have fun, memorizing just for the test and then forgets, but he graduates and he gets to college, right? And then he gets here and he goes, "What's happening? What's happening? Why? I don't know what's wrong. I did fine in high school. I don't understand." But this could be true of someone in a big city too, right? If you think about it, sometimes big cities have more money in the school system and can provide extra support. So maybe the student ratio is different, or they have more paras um, in the classroom, which then are helpful. And so people get through until they get to college, and then they don't have those same supports. They don't have their parents writing them. Don't forget that's due tomorrow. Don't forget you have this to do. Do this, do that. They're on their own. And this is where I start seeing things, over time can start unraveling. And it's very distressing. Again, very smart, capable students, um, but they just don't understand what's happening. And so it's a whole process to come to college and then start feeling this way and then seek help. And sometimes that's actually encouraged by parents more than the student, because the student's complaining and the parents are like, "I heard you have a student health. I heard there's a psychiatric provider. I heard the counseling center does ADHD testing." So the parents often will push into that. But regardless, if you're where you're from, if you're male or female, it doesn't matter. Executive functioning skills aren't something that are often really taught when we're younger. And even if it is, it's a chapter, it's a unit, it's something like that. And then if it's not encouraged and nurtured, we just don't grow it. It's like anything else. If I just quit running, I'm not going to run the marathon, in 3 years because I quit running. So it's like the same thing. You have to continue to nurture these types of skills. Okay, so I've used the word enough. Executive functioning skills. What are they, Joanna? Well, they're a set of mental skills that help people plan, prioritize, remember, focus on and accomplish tasks successfully and efficiently. This is a very long run on sentence, but it that's what it does, right? These skills are a set of skills. And it depends on where you're looking on what the name of those skills are. But these are gonna be maybe the most popular 9 that you will see. So some books will have 6 and some will have 8 or 10 or 11 or 12. But these are probably the most consistent ones. There are things like goal-directed behaviors, that can also be on here. Um, but the executive functioning skills, if we think about it, organization, right? The ability to use a system. This means a calendar, and using some type of system to keep track of information, keeping your stuff together. All my papers go here. All this class goes here. But not just organizing your school stuff. How about organizing your space? This is the other thing when it comes to it. If every time I leave I have to look for my keys, what's going to happen? I'm not going to be on time, right? I'm going to be frustrated and irritated. But if I get organized and I put a hook next to the door, and every time I come in and I put my keys on the hook, I always know where my keys are. So organization is not just your desk, which it should be, but it could be a lot of things in your life, your space. When things are more organized, our brain is clearer. We know this. Time management, right? This is the thing. Time blindness is a real thing, but so is not allotting enough time to do what you need to do. That's a real thing. But sometimes people just don't understand how long it takes to actually do something. So I work with students with that too. There's working memory. I think of this as like a chalkboard. You put stuff on there, and it's stuff you keep in your brain while you're doing a task, and you can access it. It's coming um, from skills and tools from memory. Uh, So this is a very generic explanation of these things, and my husband is a working memory researcher. He would be freaking out that this is what I'm saying about it right now. Flexible thinking, how about that? It's not all or nothing, and there is gray, the gray zone, right? And I also see a lot of stress comes from rigidity. So again, trying to get ourselves to be more flexible. Not only that, when we're flexible, um, we can problem solve better because we're not like, well, it's supposed to be like this, and we're not stuck in that. But when we're flexible, it's supposed to be like this, but this is similar, right? Planning and prioritizing, and that's just creating the steps towards your goal. Um, Task initiation, just like it sounds, emotional control, just like it sounds, regulating your emotions as well as your dysregulated emotions. So I'm freaking out, but I'm not going to hit anyone. I'm not going to throw anything. I'm not going to curse anybody out or whatever. Impulse control, stop, think before we act, right? And then metacognition is also self monitoring, where know and know you're knowing. How am I doing? How did I do? Oh, wait, that's wrong. Let me erase that and write the right thing, but also a way to reflect. So these are probably what I would consider the most common 9. And executive dysfunction is going to be the opposite. Right? So maybe this is where we're struggling. We can't organize well. We don't really know time well. We can't get ourselves motivated to start anything. Um, you know, I don't know. I had to sit down and write a paper, but it just was overwhelming. So I just like left. Flexible thinking, time management. I have a test tomorrow, but it's mug night. you know, Go to mug night. Can I move my studying to earlier to go to mug night? Right. So these are going to be some of the tips I'm going to talk about today. This is actually um, made for ADHD, And it's actually something I keep in my office and I give copies to students. Just as a template, they can find their own that works better for them. Okay. But my first thing is you have to get organized. You've got to make a calendar. Oh, no, I keep a calendar, Joanna. Blackboard has a calendar. Awesome. And then I use my Google Calendar. Okay. And then my mom bought me a planner. I use that too. And I'm like, so you have to check 3 things to know what's on your calendar. Okay, this is maybe not gonna be the best solution. Can we narrow it down? Can you get all of them synced together? And when I get someone to do a calendar, this is what I say. Here's your calendar. I want you to write all your classes in there. Then I want you to write your work schedule if they work or whatever. And then I want you to think about some of the things you have to do every week, like go to a grocery store. You know, um, how much time and where are you going to do that? And the thing about this weekly calendar is it's a bird's eye view. When I can see the week, I can look at the week, I can see where my holes are. I know what where my free time is. When I get invited to mug night, I know I'm studying from 2 to 5, but I could move it that day to 1 to 4 so that I can get to mug night. There's a way to do it, but put out what you know you have to do first. And then I want you to start putting chunks of time that you're going to study, like study time. But I want you to think about, when are you your sharpest? Not at 8 in the morning, surprising, but maybe noon, maybe 1 or 2 in the afternoon, you feel the most awake, the most alert. It's different for each individual, but I think that if you wait to put your homework from 7 to 10 at night, hmm, that might not work every night. You might be too tired. Your brain isn't maybe functioning as quick as it was at 2 in the afternoon. So this calendar, again, if you could just get started on a calendar, that's beneficial. If in the long run you don't need a calendar, that's great. But Joanna, when I put stuff on the calendar, it makes me anxious and my anxiety is out of control. I can't use a calendar. All right, well, I want you to use the calendar. You're anxious because you have a lot to do, and you have a lot to do, and you don't know how to organize it, and you don't know how to approach it. So let's start one step at a time. So this is the first thing that I usually talk about is you have to keep track, but you also have to plan ahead. And so something like this skill here isn't just um keeping a calendar, keeping me on time, right? If you think about those executive functioning skills, this has to do with organization, time management, working memory, because I can look at the bird's eye view and remember when someone invites me to bug night what my week looks like. I can be flexible, planning, prioritizing, right? Task initiation. It's 2 o'clock. From 2 to 5, I study. All right, it's 2 o'clock. Yes, I'm going to go study, right? And so there's a lot just one intervention can do, but one intervention often is not enough. So we're going to go to time. Again, like I said, there is such a thing as time blindness. People really do have a hard time recognizing and knowing time. And again, this is why I challenge them to start timing themselves. I said, I want you to go to the grocery store before now, right when you leave your apartment or your dorm or whatever. You're going to close the door, you're going to hit your timer or your stopwatch, and you're going to turn it on. And then I want you to go to the grocery store, do your shopping, bag it up, get it home, put it away, and then stop your stopwatch. How long did that take? They don't know, right? This is just teaching them. That's all it's doing. These are just things that maybe they didn't have to think about before because other people were managing or helping them managing, right? Helping them manage their lives. And so this paying attention to time, how long does it take you to read a chapter in that class? How long does it take you to do a homework in your math class? Right? How long is it taking you to actually do it? I know your teacher said 8 hours a week and you feel overwhelmed. but how long is it taking you? you know, and so this is time is something that we work on. Clocks that look like this, old school clocks, I say, are supposed to also be better, just to be able to see the hand move. They have ones that if you set it for 30 minutes, it'll give you a color for 30 minutes and then the color slowly disappears so that you can have a visual. They have a lot of different ones. I like this one because it's military time and I'm a nurse. So we always use military time. So that's the one I chose. But again, paying attention to time and managing their time and just challenging um I'm challenging students to just start paying attention to their time because this I'm telling you is such a stressor because if you look at all the things you have to do, it just feels overwhelming until you just start digging in. So get organized again, not just your space, not just your desk right here. I'm talking about you need to start organizing other areas of your life as well, right? So organize your desk. Yes, a clean desk for studying is going to be best. Absolutely. You know, a clean room is actually supposed to be better for your mental health too, right? Clutter creates clutter, chaos, right? And so keeping things tidy. But how about getting on your phone, deleting those apps you don't use anymore, right? How about you put those blocks on your social media that from, 2 to 5 when you're doing your homework, nothing comes through. Put your phone on airplane mode or whatever, but like organize your desktop on, your on your computer. All those files, put them into folders, right? Just start cleaning space so you know where to look, right? If I have, oh, where's that paper? It could be in the kitchen, it could be in the living room, it could be in my room. I don't know, maybe got thrown away. But if there was a place that I always put my papers, then I always know where to look, right? So again, organization is is really big again, just like the keys by the door, right? And again, organization, doing something like this, organization, time management, because you're not spending a bunch of time looking for something, right? It's helping me with planning and prioritizing task initiation, emotional and impulse control because I can find everything and I know where everything is. And it's the metacognition component to it too. So again, these skills aren't just managing one area of executive function. One skill can have an impact in many areas. Reduce distractions. Oh, but I always do my homework with, How I Met Your Mother. That's what I do. It has to be playing or I can't do my homework. Well, I bet you probably get more done if you weren't watching that. I don't know. I sometimes will do things with the TV on. I know I'm faster without the TV on because I'm going to pause. I'm going to listen. Doesn't matter if I've seen it 100 times. So reduce distractions. Turn your phone off. Airplane mode your phone. Do not disturb on your phone. Whatever it takes. Keep your phone on the other side of the room if you have to. If you just can't control yourself. Um, distractions also means um, trying not to pay attention to distractions, right? Uh, sometimes maybe they're doing construction, there's the jackhammer. Can I work through this jackhammer noise? Maybe if I just accept it instead of going, that's so annoying. If I go, okay, that's just the noise. Or maybe I have to put noise canceling headphones on. I mean, you really kind of have to start thinking outside of the box sometimes, but if we can reduce the distractions, we're going to get more done. All right. So Mark Twain said it, right? I'm overwhelmed. Oh my gosh, I have a 15-page paper due in like 4 days or tomorrow in some cases, right? And I'm really stressed out. It just seems daunting. I hear this a lot. I just can't even start it. It just is like the worst thing in my mind. It's so daunting, right? Well, then how about we just find a way to kind of pick it apart into smaller areas? How about like the first time you sit down to do your paper, you just brainstorm and just say you brainstorm, you just do one little thing, right? How about after your next step is you're going to go through your brainstorm and pick the ideas you like. Hey, now we're 2 steps in, right? Which is more. So we're going to break it down and eat away at it little by little. Because if I do say, just kind of like anybody who's been in school before, is if I had just think, oh, my dissertation is just seems like too big of a deal, I can't even start it. Well, of course I'm going to have to, but maybe I'm going to have to start it small, right? By reading a bunch of research to figure out what I want to do my dissertation on. So there's different ways to kind of to introduce it and to work into it without just thinking you have to sit down for 8 hours in a row and finish this paper, because that is daunting and your brain isn't probably going to do very well for most people. Right? The Pomodoro method, right? I hear this. Students are hearing about this. They're doing that, right? 25 minutes. I'm going to do a task. Then I'm going to take a 5-minute break. And then 25 minutes. I'm going to do a task, take a break. I'm going to do this for 4 rounds. And then that's 2 hours. And then I'm going to take a 15 to a 30-minute break. So again, now I have my big 15-page paper to write. How about we just do it in chunks? How about I have no motivation to start, Joanna. I can't start my paper. This is just terrible. Okay, well, how about you just spend 25 minutes trying? Brainstorm. What does it look like? 25 minutes, set a timer, um, and then it's going to go off. Then you get a 5-minute break. And, this is, again, these are just strategies to get you started. Motivation is the biggest thing I hear, right? If you're depressed, you're anxious, you have ADHD, doesn't matter, trauma. Motivation to start is just a really hard thing. So you just kind of sometimes have to start. And sometimes you have to trick yourself into thinking it's not so bad. It's not so bad if I do 25 minutes, right? I'm just going to do the Pomodoro method for an hour. Okay, that's going to work because now you just did an hour of work that you weren't motivated to do to begin with. It doesn't matter, Joanna, because I can't pay attention. I'm in class and I don't hear anything the teacher's even saying. And I'm like staring out the window yesterday. And then I look back at the teacher and he was saying, okay, and all that's due Monday. And I didn't hear any of it. Like, I am so distracted. Like, I must have ADHD or something because this is terrible. Right. And I'm like, okay, well, what are you doing to practice that? How are you practicing paying attention? Do you think this is just a magic skill that one day you're gonna wake up and you just, I pay attention now? No. You have to practice it. You have to actually sometimes practice it. And people who have an executive dysfunction sometimes have to practice. And so this might look like I'm going to put my phone down and have a conversation with someone. Normally, I talk to my friends like this. Oh, yeah, yeah, I saw that too. Yeah, yeah. Oh, hey, did you? Oh, yeah. Oh, look, look, look. Yeah, yeah. Okay. This is the conversation. What's happening? What's happening? Nobody's tracking anybody. Let's put the phone down. Let's have a conversation. How was your day? What was class like? How do you like your teacher? Right. And then repeating back what people say lets them know you're listening, but it also helps your brain remember what was just being said. And it also is inferring that you understand what the person is saying. And if they're not saying that, they'll say, well, I didn't really mean it like that. They'll clarify, right? But this is the thing, you have to sit and listen and pay attention. So I say, when you're in class, don't look out the window. Don't get distracted and look out the window. Look at the front of the class. Look at the teacher. Look at the slides. Look at the front of the class. Then this guy's bouncing and he's tapping his pen or whatever. All right, you look, then you look right back. Like, don't spend time with your mind wandering, because then you're missing everything that's happening in front of you. Right. So practice listening, and it takes effort, like to really sit and listen to for some people. So it's just something you have to practice, something you got to keep doing. Um, but the evidence is there. Now, this is the word that everybody, this is like a dirty M word. People, I say mindfulness, they're like, I hate that you said that. I can't shut my mind off, Joanna. Okay, well, you don't clearly understand mindfulness. But Joanna, I have ADHD. I can't be doing mindfulness. That's not way ADHD brain works. ADHD and mindfulness go really quite well together. And you can do walking mindfulness. You don't have to sit in some weird meditative state, with your well, knees crossed and your hands in some position. Mindfulness can really be walking. You could be eating mindfully, right? There's actually books on running mindfully. So there's a lot of ways to use mindfulness, but the evidence behind mindfulness is just it's too great to ignore. It's too great to ignore. It's kind of like our bodies are literally meant to be doing this, right? It actually improves immune function. Killer T cells go up, white cells can go up when you need them to. I mean, it can help the immune system as well as the mind. It slows your mind down a little bit because what is it doing? It's teaching you focus. Focus on your breath. Oh, but my mind wandered. Okay, well, bring it back to your breath. It's a practicing. So you're practicing, right? Um, being in the moment, but that is also teaching you a lot of other things, including impulse control. Because now I can maybe take a second to think, do I, throw that back at that person or just let it go, right? And so it helps with the impulse, the emotional control too. Oh wow, they said that kind of hurt my feelings, but I'm going to kind of move on from that for right now. I'm not going to let it ruin my whole day, and I'm not going to end up saying things that I regret later. Mindfulness can help with a lot of these types of executive dysfunctioning concerns. And so it's something that I'm always encouraging. And it's also good for your mental health. Depression, sleep, anxiety. It doesn't matter. It's good for all of it. And I think that's it. That's all I got for you. I do have a free executive functioning assessment. This is at NovoPsych. You could just go to NovoPsych and take it. And what it'll do is it'll formulate it and send you a report. It's completely free. And it'll tell you what your strengths are and what your weaknesses are when it comes to executive skills. And then the idea is find your strengths, find your weaknesses, and you can use your strengths to help you with your weaknesses, but you can also find some tasks. Remember, a lot of tasks are nurturing the whole process, right? A lot of tasks are, it's not just like one thing. It's not like practicing one thing is only going to do one area. Any questions? I talk a lot, so I offer you up some questions.
Yes. If we see that we have students in our classrooms that we think are probably struggling from some of these things that you've talked about, we can maybe like identify those. What tips do you have for us for supporting them in the classroom?
Right. Well, some of the tips that we reviewed today, you could kind of share, right? Some of those tips. The other thing is the counseling center. I know it sounds like, well, maybe they don't need counseling. Well, actually, the counseling center can actually help people strengthen their executive functioning skills. And I did hear a rumor, it's just a rumor because I hasn't been confirmed um, that they might be starting an ADHD group through the counseling center. It's just, again, that's another thing that you could go to, right? Getting support. There's other areas there's other resources in the area too. Onward. They also have some executive functioning. So it's about getting out. The thing with the counseling center, clearly it's free, and so if there's a hardship or they don't have insurance or whatever, um, that'll always, that's easiest choice. But the counselors there totally can help students build up those skills. Absolutely, they can. And again, they do testing, ADHD testing. So even if they were meeting with a counselor and the counselor was like, "This might be just more than one thing," then um, they can maybe encourage testing or even encourage him to be assessed by me. Doing a diagnostic exam. But yeah, so just giving some tips and also maybe remembering some of these things as you're putting out your materials, right? And encouraging some of that behavior. Right. Any other questions? All right. Well, have a good rest of your day. And thanks for coming.